Are there new non-invasive ways to test male fertility? Imagine being able to check your fertility without going to a clinic or providing a semen sample in a lab. Thanks to recent advances, that possibility is becoming more real. Traditionally, male fertility testing has relied on semen analysis, which involves collecting a semen sample to look at sperm count, how well they move, and their shape. While this test is generally safe and straightforward, it can be uncomfortable or inconvenient for some men. Now, scientists are exploring other ways to assess male fertility that are less invasive. One promising method involves blood tests that measure hormones like luteinizing hormone, follicle-stimulating hormone, testosterone, prolactin, and estradiol. These hormones give clues about how well the testes are functioning and whether sperm production might be affected. Researchers are using artificial intelligence to analyze hormone levels and predict fertility issues. This approach could help identify men at risk of infertility early on without needing a semen sample. It could be part of routine health checks, making fertility assessment more accessible and less stressful. Another exciting development is at-home sperm testing kits. These kits allow men to collect a semen sample at home and use a smartphone or small device to analyze sperm concentration and motility. The results are then interpreted by AI algorithms, providing a quick and convenient way to get a rough idea of fertility status. While these kits are useful for screening, they are not a replacement for comprehensive laboratory testing, which remains essential for a full evaluation. They can be a helpful first step for men who want to monitor their fertility or decide if they should see a specialist. Researchers are also investigating biomarkers in blood or urine that could reflect reproductive health. These tests could someday help assess fertility without the need for semen collection or invasive procedures. However, these methods are still in the experimental stage and are not yet part of standard clinical practice. It's important to remember that male fertility is complex and influenced by many factors. While these new non-invasive tests are promising, they are not yet a complete substitute for detailed laboratory analysis. If you're concerned about fertility, the best approach is to consult a healthcare professional or fertility specialist. They can recommend the most appropriate tests based on your individual situation and guide you through the next steps. Advances in non-invasive testing are making fertility assessment easier and more accessible, but personalized medical advice remains essential for accurate diagnosis and effective treatment.